Hi and welcome to Medicine Past, Present and Future. My name's Dr. Nick and I'm the past.
And my name's Dr. Isabelle and I'm the future.
And together,
we're the present.
Now, of all the things that cause confusion amongst my patients, I reckon cholesterol about tops the list. So let's sort this out once and for all. Dr. Isabelle, what is cholesterol?
I'm so glad you asked, Dr. Nick. So cholesterol is a waxy substance that we need to build the cell walls in our body. We actually need cholesterol to function.
Okay, so that makes sense, but where does the cholesterol in our bloodstream actually come from?
Right, so the cholesterol in our blood comes from the fats that we eat in our diet. Our liver then turns these fats into cholesterol and sends them to the bloodstream. Now, the problem only arises when we have too much cholesterol in the blood.
Now, when I was a medical student, I was told that foods like dairy, butter, cream, eggs, that sort of thing, they were bad fats. I was told you were only allowed one egg a week. And for instance, we were told that margarine was better for you than butter.
And now we understand that margarine is mostly made up of what's called trans fats, which are actually not very good for you at all.
So if you really simplify it, the animal fats, the saturated fats, probably want to keep those down a bit, whereas the plant fats, things like olive oil and avocados, are better for you. But Dr. Isabelle, there's this other thing about what's called good and bad cholesterol. Can you explain that to us?
Yeah, so when we test your cholesterol, we look at two different types. We look at your HDL cholesterol, which is your good cholesterol, and that's really protective for your body, and your LDL cholesterol, your low density cholesterol, which is your bad cholesterol. Now, that's the kind of cholesterol that's more likely to build up in your arteries. If you have too much cholesterol in your blood, it can put you at higher risk of things like heart disease and stroke. But Dr. Nick, how often should people be checking their cholesterol?
Well, I reckon everybody should have their cholesterol checked at least once to get that baseline, and then probably every 5 years or so is about right, because cholesterol doesn't really change with age, it changes with lifestyle. So if you decide to sit on the couch and eat nothing but junk food, maybe get retested a little bit sooner. Because Dr. Isabelle, that's the other thing people always ask me is, how do I get my cholesterol down?
And this is where we start sounding a bit like a broken record, Dr. Nick, because it's those really basic lifestyle things, which are making sure you get enough exercise, keeping your weight under control, and of course, having a healthy diet. Now, that can sometimes not be that easy for people because there's a lot of conflicting information about diets out there. So what advice do you give your patients, Dr. Nick?
Yes, after 40 years of clinical medicine, I think I've seen just about every fad diet come and go. But I think you can't go past the very simple advice from the food writer, Michael Pollan. And what he said was three things: eat food, not too much, mainly plants. And by food, he means fresh food, stuff that doesn't come out of a packet or a tin.
Thank you very much, Dr. Nick.
And thank you, Dr. Isabelle.
Oh, I think we deserve a bit of a break now. Actually, I brought you a snack.
Oh, thank you very much, but I brought my own.
Why do I bother?